there's sort of three pain points that we wanted to focus in on for states in terms of reasons why they need to think about making this transition. The first one we've been focusing on is the cost. There's a lot of reasons why it can be cheaper for a state to run their exchange versus having the federal government do it. There's some fairly high fixed costs at the federal level. There's some issues with integration, with the call center and the healthcare.gov platform, for example. But what we've seen is innovators like Softheon and others, be able to integrate the two, integrate the systems, and then do it at a lower cost over time. And so along with that comes the opportunity for the state to set the user fee. So Cheryl showed the map with New Jersey and Pennsylvania. Both of those states chose to leave the federal exchange and do their own thing, and they were charging a lower user fee, or actually running the exchange at a cheaper rate and using the savings to run their own reinsurance programs. So both of those states implemented reinsurance programs using money that they saved going from the federal exchange to the state exchange. No other state money was required. And in Pennsylvania, for example, their reinsurance program saved their enrollees about 10% on their premiums versus what it would have been without the program. So you see it's a real impact for those folks. Another reason that we're seeing sort of the business case be there is that the states are really able to make the decisions around marketing, how much is spent on navigators, what direction do they want to go with that. And they're also able to leverage agents and brokers out there really to a higher degree in the future. And that's something that, while I was working at CMS, something I omitted from my background earlier is I was the director over the Center for Consumer Information Insurance Oversight for 4 years. And we really saw the agents and brokers really shine, and they're continuing to shine in terms of reaching the uninsured, enrolling people in subsidized coverage. And so I think there's a real opportunity there for states to have more self-direction. And then even for those states on the right-hand column that Cheryl mentioned, some of the less populated states, we think there's still an opportunity for them to group together in some cases and do a shared services exchange. So it's not necessarily a regional exchange like you heard early on with some of the states wanting to truly merge risk pools and that sort of thing. It's really more just a bulk purchasing of the software and the call center staff and that type of thing, to where they can drive the cost down even lower and have that flexibility. So the other type of pain point I wanted to mention is the lack of autonomy that states feel on the federal exchange, and it's certainly a real thing. If you're on the federal exchange, the federal government sets the open enrollment period, all the special enrollment periods, what all the rules are for that. And those can really impact the premiums in your market. The insurance carriers, the actuaries will increase the premiums if they think that there's adverse selection taking place. In other words, if people are waiting until they get sick to buy health insurance. So that all gets built into the price of coverage and can increase the premiums. The state also, under a state-based exchange, gets to certify and decertify qualified health plans. So they are making the decisions about what plans will be sold and will be the final decision maker under the statute. As long as they follow the federal rules, the state really has a lot of ability to have autonomy in this area in selecting what plans are displayed. They also have full control over the website, how it looks, the call center, the shopping experience for the consumer. So that gives them the ability to, if they want to go in the direction of, showing standardized plans, they can do that. If they don't want to do that, if they want to let 1,000 flowers bloom and sort of let the agents and brokers and the assisters, guide people to the right plans, they can take that approach. So there's wide leeway in how they structure the shopping experience. And then the last thing I'll talk about on the next slide is flexibility sort of in policy making and reform of their systems. So one thing we found at CMS when I was there is there's very little flexibility on the federal platform for states to do much in terms of whether it be waivers or looking at ways to make insurance more affordable and more accessible. The federal platform is just a little bit too rigid, and it's really hard to do a lot of specialization when you're operating in 38 different states. So one thing that states can look at, or there's a number of options that states are looking at, small business premium credits. I talked about savings that were available to Pennsylvania and New Jersey to do reinsurance. Well, you could imagine a state using those same savings to create a small business tax credit to sort of strengthen the link between employment and coverage, which is really important. State-specific premium assistance. States can actually, through a waiver, adjust how the premium tax credit works, whether it be the income levels, whether it be through an account-based subsidy or whether it works today where the subsidy goes direct to the insurance company. And there's also easy enrollment options. You've seen a number of states do this already. Like I think Maryland has done this. Massachusetts has certainly done it. But these are states that are on their own state-based exchanges that are really have the flexibility to do this. And finally, I mentioned reinsurance. There's multiple options for states there to stabilize their market. And finally, coverage portability. And that's something that, at CMS, we worked on a rule promoting individual coverage health reimbursement arrangements that allow employers to provide funds to their employees to go to the individual market to buy their coverage. You can imagine a state really leveraging that concept in their exchange, really making it easy for both the employer and the employee to figure out how to navigate the HRA, how to select a plan, how to work it in terms of the documentation necessary. So there's a lot of opportunities, for states to innovate that open up essentially under a state-based exchange.